Hey everyone, welcome to our channel. You know those early days with a newborn, the cuddles, the quiet moments, the overwhelming love, and the challenges. If you're breastfeeding, you know it can be amazing, but it can also be really tough. From latch difficulties to milk supply concerns, it sometimes feels like there's a whole new hurdle every day. I've invited some incredible moms and experts to share their experiences and evidence-based tips to help you navigate your own feeding journey. Whether you're a first-time mom feeling the pressure or a seasoned pro needing a little reassurance, remember this: you are not alone. Let's dive in and empower ourselves with the knowledge and support to breastfeed with confidence. Let's start with the foundation of breastfeeding, getting a good latch. It can feel like the holy grail, right? I remember those early days with my little one, trying to figure out how on earth this tiny human was supposed to latch. It can be tricky. A proper latch is crucial, not just for your baby to get enough milk, but to prevent nipple pain. You want your baby to take in a large portion of the areola, not just the nipple itself. Think of it like they're going for a big, open-mouthed yawn. If you're experiencing pain, don't hesitate to unlatch your baby gently and try again. Experiment with different breastfeeding positions. The football hold was a game changer for me in those early days, while other moms swear by the cross-cradle hold. It's all about finding what feels best for you and your baby. Be patient, be kind to yourself, and don't be afraid to ask for help. Trust me, with a little practice and the right support, you'll both get the hang of it. Okay, let's talk about sore nipples. This is a big one, and it's something almost every breastfeeding mom experiences to some degree. In the beginning, it's totally normal to have some tenderness as your nipples adjust to this new way of life. But if it's persistent pain, we want to address it. The most common culprit? You guessed it, an improper latch. When the latch isn't quite right, it can cause friction and irritation, leading to soreness and even cracking. So what can you do? First and foremost, keep working on that latch. Experiment with different positions, and if you're unsure, don't hesitate to reach out to a lactation consultant for guidance. In the meantime, there are things you can do to soothe and heal your nipples. Lanolin cream is a lifesaver. It's safe for babies, so you don't have to worry about wiping it off before breastfeeding. Express a little milk and let it air dry on your nipples. It has amazing healing properties. And remember, if the pain is severe or doesn't improve, reach out to your healthcare provider. Let's talk about milk supply, because this is a topic that can cause a lot of anxiety for new moms. First things first, it's important to remember that every woman's body is different. Some women naturally produce a lot of milk, while others might need a little extra support to boost their supply. One of the biggest myths out there is that you can tell how much milk you're making based on how your breasts feel. The truth is, breast fullness isn't always an accurate indicator. Some women have naturally fuller breasts, while others might not feel engorged at all, even if they're producing plenty of milk. Another common concern is pumping output. It's easy to get caught up in the numbers game, but remember, a breast pump is not a baby. If your baby is having plenty of wet and dirty diapers and is gaining weight steadily, that's a good sign that your milk supply is sufficient. Of course, if you have any concerns about your milk supply, it's always best to talk to your doctor or a lactation consultant. Now let's flip the script for a moment. While many moms worry about having enough milk, some experience the opposite: oversupply or a forceful letdown. If this is you, know that you're not alone. And there are ways to manage it. A forceful letdown happens when your milk releases rapidly and with a lot of force. While this might sound convenient, it can actually be challenging for babies, who might cough, sputter, or even pull away from the breast. One way to manage a fast letdown is to try nursing in a more reclined position. This allows gravity to work in your favor, slowing down the flow of milk. You can also try expressing a small amount of milk before each feeding to take the edge off. Another helpful tip is to offer the same breast for shorter intervals, especially in the beginning of a feeding session. Be patient with yourself and your baby, and don't hesitate to reach out to a lactation consultant for support. Easing engorgement. Tips for relief and preventing blocked ducts. Engorgement. It's that feeling of fullness, tightness, sometimes even pain that can happen when your breasts are overly full of milk. It's common in the early days of breastfeeding as your milk supply regulates, but it can also happen at other times, like when your baby starts sleeping longer stretches at night. First things first, engorgement is usually temporary. The key is to manage the discomfort and prevent it from leading to complications like blocked ducts or mastitis. One of the best ways to relieve engorgement is to nurse your baby frequently. Think of your baby as a little pump. They're the most efficient at draining your breasts and providing relief. If your baby isn't able to nurse, pumping can also help. Warm compresses can work wonders for engorgement. Gentle massage can also be helpful. Okay, let's talk about breastfeeding in public. This is a topic that can bring up a lot of different emotions for moms. Some moms feel completely comfortable nursing anywhere, anytime, while others might feel nervous or self-conscious about it. And you know what? Both of those feelings are totally valid. The important thing is that you feel empowered to feed your baby whenever and wherever they need to be fed. If you're feeling anxious about nursing in public, there are a few things you can do to build your confidence. Start by practicing at home in front of a mirror. When you're out and about, choose a spot where you feel comfortable. We've covered a lot of ground today, and I hope you're feeling more empowered to navigate the ups and downs of breastfeeding. But there's one last crucial thing I want to emphasize. Trust your instincts. You know your body and your baby better than anyone. If something doesn't feel right, don't hesitate to reach out for help. If you're experiencing ongoing pain, if you suspect your baby isn't getting enough milk, or if you notice any signs of infection, like fever, breast redness, or flu-like symptoms, please reach out to your healthcare provider or a lactation consultant right away. Early intervention is key when it comes to breastfeeding challenges. You've got this, Mama. Breastfeeding can be a roller coaster ride full of highs and lows. There will be good days and tough days, moments of pure joy and moments of doubt. But through it all, remember this: you are amazing. Your body is incredible, and you are giving your baby the best possible start in life. Whether you breastfeed for a few weeks, a few months, or a few years, know that you are doing a wonderful job. And if for any reason breastfeeding doesn't work out the way you planned, that's okay too. Fed is best, always. Thank you for joining me on this journey.